Before we dive into statin side effects today, I want to say something. A lot of distrust that you feel about cholesterol medication is completely justified. For years, the pharmaceutical industry and medical guidelines push statins incredibly hard, even for frail older adults where the risks of daily muscle fatigue outweigh the benefits. So if you are skeptical about this pill, you have every right to be. In fact, as a geriatrician, I actually take my patients off cholesterol medications every single week. But there is a right time and a wrong time to stop. And right now, the pendulum has swung so far in opposite directions that alarming internet headlines are terrifying older adults into throwing away their medications in the dark, abandoning a shield that could genuinely save their brain and protect their independence. So today, we are stripping away the pharma marketing and the internet myths. We are going to look at what is real and what is false, how to protect your muscles and liver, and exactly when and why I actually stopped this medication in my clinic. So let's get into it. Let's start with the most common reason people throw their pill bottle away: muscle aches and joint stiffness. First of all, if your legs or shoulders hurt after starting a medication, I believe in you. Your pain is real, and I never dismiss my patients when they report it. But before you quit cold turkey, I want to share a fascinating medical secret with you. In a famous double-blind trial, cardiologists worked with volunteer patients who suffered from statin side effects to see what was really happening in their bodies. The participants agreed to take either a real statin or an identical placebo pill for several months, with neither the doctor nor the patient knowing which bottle was active at the time. The results were astounding. Over 90% of the reported muscle aches happened when patients were taking the inactive placebo pill too. And crucially, half these patients are able to restart statins successfully. So why does this happen? Because as we get older, everyday arthritis, joint wear and tear, and normal morning stiffness are part of life. And when we start a new medication, it's completely natural to hyper-focus on every ache and blame the bottle. Here's the golden rule I give to my patients. If your muscles hurt, do not just stop in the dark. Tell your doctor. Why? Because we can easily pause the pill for 2 weeks just to see if your aches actually disappear. And if the medication is causing a little irritation, we do what I call a statin reset. We don't force you to suffer. We can switch you to a different type or lower your daily dose. Or we can even use longer acting statins and have you take the pill every other day instead of every night. You do not have to choose between living in pain and protecting your heart. We just have to tailor the dose to your body. Next, let's look at two routine blood test alarms that cause widespread panic: your liver and your blood sugar. Sometimes, after you start the statin, your doctor runs a blood test, and your liver enzymes show a mild jump in inflammation. And while statins can cause a temporary ripple in those numbers early on, here is a clinical reality check that surprises most people. Very often, that slight liver inflammation isn't caused by the statin at all. It's actually caused by underlying fatty liver disease, a very common condition where fat builds up in the liver. And here's the medical twist. If you have fatty liver disease, continuing your statin is actually one of the best things you can do to protect your cardiovascular system. So, unless those numbers jump dramatically high, we don't blindly stop the medication. We investigate the root cause. Now, what about blood sugar? Does taking a statin cause diabetes? Let's look at the real mathematical scale without the fear. If we treat between 100 to 250 older adults with a statin for 5 full years, we might roughly see one extra case of mild diabetes. And almost every single time, that one case happens in someone whose blood sugar was already sitting right on the edge of pre-diabetes. So let's put that into perspective for your heart. If you are found to have high risk of heart disease or strokes, or if you already have built up plaques inside your blood vessels, your immediate danger is a sudden blood clot, not a tiny blood sugar shift. So ask yourself, would you trade a minor, manageable nudge in your blood sugar to prevent a catastrophic, life-altering stroke or heart attack that robs you of your independence? When you weigh a high risk of stroke against a tiny blood sugar ripple, the trade-off is overwhelmingly in favor of protecting your heart and your brain. Now, let's talk about the elephant in the room. This is an argument you see everywhere online, and it frightens my older patients the most. Dr. Lim, our brains are made of cholesterol. If I take a pill that lowers my cholesterol, won't I starve my brain and cause dementia? It sounds logical on the surface, but let me show you how your body actually works. It is true that your brain needs cholesterol to function, but here's the biological secret. Your brain sits behind a fortress wall called the blood-brain barrier. Because of that wall, your brain cannot absorb cholesterol from your bloodstream or from the food that you eat. Your brain is a self-sustaining ecosystem. It manufactures 100% of its own cholesterol locally on site. Because blood cholesterol and brain cholesterol live in two separate walled-off systems, lowering the cholesterol in your blood vessels do not starve your brain of the cholesterol it builds for itself. So now, a savvy internet reader might argue, wait a minute, doctor, what if the medication itself crosses the barrier and shuts down my brain's factory? It's true that certain fat-soluble statins can enter the brain, but when we look at the massive real-world human studies following hundreds of thousands of older adults, we see that these medications do not cause Alzheimer's or permanent dementia. In fact, the data shows that they are likely neuroprotective, meaning they actively guard your memory as you age. How? Because a massive amount of memory loss in older adults is caused by vascular damage. Microscopic blood vessels in the brain getting clogged with plaque, leading to tiny, silent microstrokes over the decades. By keeping these microscopic blood vessels clean and cooling down inflammation, your statin is actually acting as a long-term shield for your brain health. But here's my insight, and this puts all fear to rest. If you're still deeply worried about medication entering your brain, or if you feel a little bit of temporary brain fog, you have a choice. We can prescribe what is called a water-soluble statin, such as rosuvastatin or pravastatin. Because they are water-soluble, these specific medications do not cross the blood-brain barrier at all. They stay strictly in your bloodstream to clean your arteries, leaving your brain completely untouched. You don't have to fear the bottle. You just need the right prescription for your peace of mind. But what happens when tweaking the prescription isn't enough? What happens when it is simply time to stop the medication entirely? Remember at the beginning of this video when I told you that I actively take my patients off statins? Let me explain exactly when and why we do that. As a geriatrician, when my patients enter their late 80s or 90s, or if they develop severe physical frailty and their overall health goals change, we actively deprescribe this medication. Our priority shifts entirely to daily comfort and reducing pill burden. And if you are worried that stopping the medication means you instantly lose all your heart protection, I have incredible news for you. In medicine, we call it the legacy effect. Research proves that taking a statin for just a few years in your 60s or 70s leaves a lasting protective legacy in your blood vessels. You have stabilized the plaque. You have cooled down the inflammation. You have delayed the damage. It's like putting money into a health savings account. Even if you and your doctor decide to stop the medication years down the road, your risk of heart attack remains lower for years afterwards. Simply because you protected your arteries when it mattered most, you are never trapped on this pill. Here's the bottom line. You do not have to choose between protecting your heart and enjoying your daily life. Serious side effects are rare. They are manageable. And you should never feel trapped on a prescription that makes you feel miserable. If you're frustrated with your medication, don't just throw the bottle away in the dark. Take the lessons from this video, go to your next doctor's appointment, and have an open, collaborative talk about your dosages, your timeline, and your daily comfort. If this video gives you peace of mind today, hit the subscribe button so you don't miss our next episode. I'm Dr. Lim, and I'll see you in the next one. Bye.